President Bola Tinubu has allocated 2.48 trillion naira to Nigeria's health sector in the 2025 budget. This boost represents about 5.18% of the 49.7 trillion naira total budget estimates. TVC News' Kemi Balogun has more details.
The debate over improved healthcare funding in Nigeria will continue, but for now, the 2025 budget shows that the present administration appears willing to step up to the plate in giving citizens an improved healthcare system. As stakeholders urge the government to prioritize health in national planning and ensure the well-being of its citizens, President Bola Tinubu has now given a boost in the budget for healthcare. This time around, it is pegged at 2.48 trillion naira, which is the highest in more than 3 decades. Healthcare now has 2.48 trillion, representing 5.18, an increase from 1.3 trillion, which is 4.6% of the 28.7 trillion in the 2024 budget. 402 billion naira has been allocated for infrastructure investments in the health sector in the 2025 budget, and another 282.65 billion naira for the Basic Healthcare Provision Fund. Although the proportion that has been allocated to healthcare in the 2025 budget still falls far below the Abuja Declaration expectation in 2001, experts still believe that this budget is an intentional one.
The last 10 years, our budget, fairly remained the same, around 5%.
Dr. Aminu Magashi is a coordinator of the African Health Budget Network. He says this budget has unique allocations, which makes it better than previous ones.
A little paradigm from the previous one. We don't normally have that kind of big money, for infrastructure in the health sector. And last year, 2024, the Basic Healthcare Provision Fund was around 125 billion naira. It has doubled this year. Both in value and numerically, we have more money this year than the previous year.
With an existing plan to strengthen primary health care, revitalize hospitals and ensure access to quality care for all Nigerians, this expert believes utilization of funds still remain key, especially in reducing the major issues hindering major health indices, like addressing maternal mortality, zero-dose children and others.
We need to ensure that our pregnant women, they are attended during antenatal care, they have a skilled birth attendant and facility delivery. We need to ensure that our primary health care, secondary and tertiary, they have fully functional facilities. Electricity should not be a problem. With all this budget, we should manage our money in a very efficient, transparent and accountable manner, and we can celebrate Mr. President if we can achieve that.
Some Nigerians express their satisfaction on the increased health budget, but say more needs to be done.
This budget will be impactful, and though we are like Oliver twins, we always need more. We want more, a kind of standard hospital, good access to medicare, and issues that has to do with child and woman mortality.
There has been an increase in their services, but the one I want the government to look into is in the high prices of drugs.
The Coordinating Minister of Health and Social Welfare, Professor Ali Pate, revealed only recently that there has been an exponential increase in financing and expansion of primary healthcare services, which has led to over 10 million Nigerians accessing critical services in the Basic Healthcare Fund primary healthcare centers in the last 1 year across the country. Nigeria's healthcare will still need to remain a priority for many more budget cycles in order to address the persistent and evolving challenges that still face the health sector. Kemi Balogun, TVC News, Abuja.